Another critical debate in Annapolis, this one focused on protecting hearts in Maryland after many learned that they were offered a stent procedure they didn't need. Lawmakers are working to better regulate that surgery. WJZ is live in Annapolis. Mike Helgren breaks down the new safeguards under consideration tonight. Mike?
Kai, for many of you, nothing is more important than your health. This would provide some teeth into regulations involving those stents which have been so controversial in Maryland. Maryland is considering tough new regulations to protect heart patients from unnecessary operations. The push is an aftershock of the scandal that shook the medical community to its core. The dramatic fall of one-time star cardiologist Dr. Mark Madej, accused of putting hundreds of unnecessary stents, tiny mesh devices that unclog arteries, in his patients at St. Joseph Medical Center in Towson.
Patients are getting all this bad information, and patients are not understanding how to seek good quality care.
The new legislation would require labs hold special certification, that they be subjected to the review of their peers, and the state come up with guidelines to prevent unneeded, expensive, and potentially dangerous operations.
I think I deserve protection, and I think every patient does. And it is so easy to give a knee-jerk reaction, even on the part of physicians and well-trained and experienced physicians, to have a knee-jerk reaction and say, this is what we're going to do.
The Madej case has prompted other states to consider similar regulations. Dr. Madej is also accused of having a relationship that was too cozy with a major stent manufacturer, but has denied any wrongdoing.
The cases that I was doing were the same kinds of cases that were being provided to patients across the U.S.
At $10,000 each, the stent operations are lucrative, and lawmakers, doctors, and patients who support tighter controls say decisions should be based on what's best for the patient and not the almighty dollar.
It is important that we as the physician leaders really are out on the forefront and are working hand in hand with the legislators.
And if this is passed, it would not go into effect until 2014, giving hospitals and labs time to do it right. Reporting live in Annapolis, Mike Helgren, WJZ Eyewitness News.
Mike, thank you. Right now, Dr. Madej and St. Joseph face dozens of lawsuits from patients, and Dr. Madej is suing St. Joseph, claiming they destroyed his reputation.
Maryland